right, and last but not least, we're very excited to welcome Dr. Jennifer Mundt to talk to us about, how many of you guys have trouble sleeping? Anyone? So she's going to talk to us about maintaining sleep and better mental health. Welcome, Dr. Mundt.
Okay, so I'm happy to be here today to talk to you. I'm a clinical health psychologist and I specialize in sleep. And excited that you have me here today to talk about some of the psychosocial aspects of scleroderma. I noticed early in the beginning of today, Dr. Brenner mentioned this term biopsychosocial. So when you said that, my ears perked up. That's something that I want to talk about, is this idea of this biopsychosocial model, how all these things are interconnected, and then talk about some of those psychosocial aspects. Specifically, we're going to talk about sleep and general mental health. So I've split this talk into two main sections. We're going to start by talking about a little bit of background information, talk about this biopsychosocial model, review a little bit of research that's been done on the psychosocial impact of scleroderma, and then I want to transition to talking about things that are hopefully really practical, that even if you're a support person here who doesn't have scleroderma, you might find something useful. We're going to talk about just general strategies for maintaining good sleep, improving your sleep if you do have sleep problems, and some strategies for maintaining mental health. So to get us started thinking about this topic, I wanted to just have us think about what is the impact of scleroderma. Obviously, we've heard a lot today about how it affects your body and the physical symptoms, but we know it's more than that it affects you as a whole person. It affects your functioning, your relationships, your mood. It can affect things like sleep and work. So this is what we're thinking about when we talk about this biopsychosocial model of how are all of these things interconnected, that it's more than just the physical and the biological. So in the same way, when we talk about what is health, we're also thinking about all of these things, that it's not just improving the physical symptoms, it's improving your quality of life, it's improving your mood and all of these other facets. So this is a diagram of traditionally what we think of as this biopsychosocial model. So bio is for biological, psycho is for psychological, and then there's the social. So all of these things are interacting and all affect one another. And this is something you probably already knew intuitively, even if you've never seen it kind of laid out like this. But of course, you're well aware of how having an illness is affecting you in other ways, just besides physically, right? Psychological would include things such as mood, your thought patterns, your personality, your actions. Social could be things all the way from the micro, like your friends and family, the people you interact with on a daily basis, all the way up to the macro, things like society and culture, the economy. So all of these factors, they're all interacting with you on an individual level and all play into your health. So I put in the center of this health and quality of life, that all of those things really in combination is what's making health and quality of life, or lack of it. So coming into this, I actually didn't know much of anything about scleroderma when I was asked to do this talk, so I was curious to go look at research and see, well, what's been done with regard to sleep, with regard to mental health, and looked at what had already been researched. So I'm going to review a couple of interesting things that I came across. This first paper was published in 2010, and this was about, it was a group of people that got together to come up with an agenda for what should we be studying and researching in scleroderma, specifically with these psychosocial factors. And I thought they had a really nice approach where their panel included experts, but it also included patients. So they were trying to come up with a consensus of what should we be looking at, what's important. And they reviewed, summarized what research had already been done in these areas. And most of them, there had been a little bit of research, maybe not very much. So here on this slide is the list of the things that they identified as being really important. And so it's interesting, first of all, just to note that some of the things on here we might think of as medical symptoms like pain, itch, fatigue, but they're including these in a list of psychosocial variables, right? Knowing that these are going to affect the whole person. So depression, fatigue, sleep, pain, itch, body image distress, sexual function, and disease-related stress, which included distress related to things like healthcare costs or fears of becoming dependent on others. This was the list of things that these authors identified as these are important factors we should be looking at and researching more. So this is from 2010. And I want to review the findings from a subsequent paper that was published in 2015, reviewing all the research that's been done on these areas. This was the most recent review that I could find. So it's a few years old, but it gives us a summary of the research that's been done in these areas. So first, looking at mood and body image. So this is in studies of people with scleroderma. There are high rates of depression, high rates of anxiety. So these rates here of depression and anxiety are higher than the normal rate for just the general population. So high risk of having major depression at some point in your life, high risk of having an anxiety disorder at some point in your life. And for anxiety disorders, the risk was specifically for generalized anxiety, which is like being just worried in general about a lot of different things, and also for social anxiety. And they noted some of the reasons why this might be, that because of the nature of having a chronic illness, there can be a lot of uncertainty about the future. How is this going to progress? What's going to happen? Will I be dependent on other people? Those sorts of things, that really will feed into this generalized worry and anxiety. For social anxiety, that's been particularly linked to the third thing on this slide, which is body image distress. And I didn't find any statistics on how common that is, but they just brought this up as something that is prevalent, especially when there's concerns about appearance of hands and face, which makes sense. So this body image distress has been linked to social avoidance, isolation, anxiety, depression. Fatigue, pain, and itch, all extremely common symptoms in scleroderma. Almost all patients that were surveyed said they have fatigue at least some of the time. Likewise, pain is also very common, 60 to 83% of individuals saying they have pain, and this could be localized or it could be widespread. It could be due to a lot of different underlying symptoms. And itch is also incredibly common, 43% of individuals saying they have itch on most days. Sexual function is something that's also been researched, and the research has shown that women with scleroderma, particularly are affected by sexual function issues. They're compared to their peers without scleroderma, they're less likely to be sexually active, and they're more likely to have sexual impairment, so issues with things like arousal, lubrication, desire, things like that. And some of the physical factors that have been linked to these sexual issues have been they've been identified as things like skin problems, GI symptoms, and breathing problems, as well as having more severe Raynaud's symptoms and vaginal pain. And for men, erectile dysfunction is fairly common in scleroderma, and this has been linked to changes in arteries and tissues, and it's particularly due to issues with, or more common in people who have severe problems with skin, muscular or kidney involvement, and who have diffuse disease. All right, and sleep is something we'll be talking more about in terms of general sleep strategies, but to review the research that's been done on sleep and scleroderma, I looked at some other studies as well, some more recent studies. I know a couple of my colleagues have come and presented at this in past years and probably have told you there's not much research been done on sleep and scleroderma, but here's a summary of the research I was able to find. So there was one really interesting study where they gave patients with scleroderma a list of symptoms, of 69 symptoms, and they had them rate each of those in terms of how often does this affect you and how big is the impact. So sleep was rated really highly. It was the 5th most frequent symptom, or sleep problems were the 5th most frequent problem. And this was rated number 4 in terms of having the highest impact on daytime activities. So sleep is obviously a big problem. And compared to individuals who don't have scleroderma, people with scleroderma have worse sleep quality. They report having more disturbed sleep, which includes taking longer to fall asleep, waking up more during the night, being awake for longer during the night. They have more daytime sleepiness, and they feel less rested upon awakening. So as I was reading that 2015 paper, one thing I noticed is they were pointing out different connections between these factors. They would summarize the literature on, say, depression, but then they would note, oh, well, this is also linked to that or linked to this. So I wanted to diagram that for you here, that these are all the different connections they outlined of how these things interact with each other, that they all affect one another. So that's just from that one paper, but then based on other research, we can add in all of these other connections. So basically we end up with a diagram showing that everything is affecting everything else. And you might look at that and that might feel overwhelming, or it might seem kind of bad, but I look at that and to me it actually gives me hope. As a clinician, when I'm treating sleep issues, I know that if I can improve someone's sleep issues, it's going to have a ripple effect on their pain, on their depression. So we know that if we can affect any one of these, it actually has the potential to help improve other domains as well. So I think that's a really helpful way to look at it, that these are all interconnected, which can be bad, but it can also be good. We can start with any one of these and it'll have a ripple effect positively. All right, so here's where I want to transition to talking about more just practical information, things that you can hopefully use to help improve sleep. I wanted to start off with just the general guideline for how much sleep should we all be getting. I think everyone has usually heard the number 8 hours. Is that what people have heard? Yeah, usually 8 hours is what we hear. That's how much sleep you should be getting. And the recommended amount for adults is 7 to 9 hours. So 8 falls right in the middle of it. But it's not that everyone needs 8 hours. Some people are perfectly fine on 6.5 or 7. Some people need more. Some people need 9 hours, 10 hours. There's a range of what people need. But in general, for most people, 7 to 9 hours is what we should be striving for. Before we talk about some sleep problems and what we do with that, I wanted to just review a few things about what is normal sleep, some things that I hear a lot in the clinic that people come in with concerns that maybe actually is just a normal experience. For example, occasionally having difficulty falling asleep or difficulty staying asleep. We all experience that at one point or another, so that's completely normal. And as a rough cutoff, I would say if it takes you about 30 minutes to fall asleep, that's also considered perfectly normal. So it's not that the expectation isn't that you're going to fall asleep immediately. I know we'd all like to be like that and just fall asleep right when our head is the pillow, but that's not always the case. So again, there's a range of what's normal. If it's taking you 20, 30 minutes to fall asleep, I would tell you that's normal. There's nothing we need to change about that. It's also completely normal to wake up a few times a night. I hear a lot from people that they want to just sleep through the night, not wake up at all. But we're all going to wake up. That's just a normal part of these sleep cycles we go through. We're going to have short awakenings during the night. Another thing that's normal is that sleep, you'll probably notice that it feels a little different at the beginning of the night versus the end of the night. And I put a diagram here showing what these sleep cycles look like through the night. And the thing I wanted to point out is how it, I don't know if you can see the print there, but that lowest stage there is stage 3. That's what we call deep sleep. And you can see that most of that comes in the beginning of the night. In the beginning of the night, you're spending a lot more time down in that stage 3 deep sleep. And then as the night is going on, you're in lighter sleep. So you might have noticed that sleep feels a little different from the beginning of night to the end of the night. And that's also just completely normal. The end of the night, it's not going to be that really deep, heavy sleep. Having occasional upsetting dreams or nightmares is also really common and really normal. Now, some possible issues that if you have any of these, you might want to talk to your doctor or see a sleep specialist. These are some problems with sleep that can be evaluated and treated if there's a problem. So this would be things like if you have persistent difficulty sleeping, if you have difficulty staying awake during the day, or if you're dozing off during the day, if your sleep feels unrefreshing. You might snore loudly, you might wake yourself up snoring, wake yourself up snorting, gasping, choking, or more likely you've seen a partner do that. So those are all things that you would want to get evaluated, symptoms of possible sleep apnea. Also, if you stop breathing in your sleep or if your partner's observed that. Restless legs at bedtime is something that you could get treated for. If you move around a lot in your sleep, and again, you might not know this, but maybe someone has told you you kick your legs in your sleep, or you were thrashing your arms around, or that would be something that could be evaluated. Also, if you're walking in your sleep, talking in your sleep, getting up and eating in your sleep, all of those are things that should probably get evaluated. And if you have frequent nightmares, if they're happening enough that they're really bothering you, that's also something that we can evaluate and treat. Okay, so this isn't an exhaustive list, but probably the most common things, the most common reasons why people would come to a sleep clinic, or start by talking to your primary care doctor if you have any of these concerns. And for the rest of the section on sleep, I'm going to focus on insomnia. So that's the thing that I spend the most time treating as a psychologist. It's the most common sleep disorder. So this is something that probably everyone in here has experienced. If only for a night or for a week, we've probably all experienced this at some point in life. So insomnia is simply difficulty falling asleep or difficulty staying asleep. And at any given time, about 30% of the population has some symptoms of insomnia. So it's incredibly common. About 10% of the population have symptoms that are severe enough that it affects their daytime function. So again, occasional difficulty sleeping is normal. We define chronic insomnia as when it's happening 3 or more times a week and it's been going on for 3 or more months. But even if it doesn't quite meet those criteria, if it's really gotten to a point that it's bothering you, it's something you could seek treatment for. Okay, we'll get to some strategies specific to improving insomnia, but I wanted to start with just some general recommendations that are helpful for anybody, even if you just have good sleep. These are strategies that will just help you to maintain good sleep. And these are strategies that we generally would put under the label of sleep hygiene, things that are good preventative strategies to help keep your sleep in good shape. So these are basic things like allowing enough time for sleep, keeping a consistent sleep schedule, allowing yourself to wind down before bed, having a relaxing routine that allows your body to become calm so that you can fall asleep. That would include avoiding stimulating activities before bed. You want to have a bedroom environment that's comfortable in terms of temperature, light, all of those things, noise. Avoiding caffeine late in the day is a good idea, and everyone's a little different with this, so generally avoid caffeine in the evening, but for some people it might mean no caffeine in the afternoon or only having just a little bit in the morning. So know your body and you might need to modify that. You want to avoid alcohol within a few hours of bedtime because as your body's processing the alcohol, it will tend to disrupt your sleep. You'll have poor quality sleep, you'll wake up more, so it'll affect your sleep quality. You want to avoid heavy meals close to bedtime, especially if you're dealing with issues like GERD. You might need to avoid eating certain foods, and that was talked about earlier today. Exercising regularly is going to be helpful for sleep, just in general, not too close to bedtime. Depends on how it affects you, but for most people, exercise is pretty stimulating, so you just don't want to do it close to bedtime. And if you do nap, in general, it's a good idea to limit those naps so that they're fairly short, maybe only 20-30 minutes, and it's early in the day, like midday, early afternoon, because if you nap too late in the day, it'll often affect your sleep that night. You might not be able to sleep as well that night. Okay, so those are just general overall strategies for sleep. Let's talk about what happens with insomnia. And when someone has a chronic insomnia problem, these strategies usually aren't enough. These are more preventative strategies if you don't have a sleep problem. But with insomnia, other factors start to come into play, and we need to implement other changes. So I want to talk about how insomnia develops. And in sleep research, we have this model that we use to describe this. It's called the 3 Ps model. And I want to walk you through this. So this first factor we call predisposing factors. So what this graph is showing is over time from left to right, and then there's that dotted line, which is the insomnia threshold. So when this bar gets above that threshold, the person has insomnia. These predisposing factors, you can see that doesn't change over time. This is just a constant. Think of this as your baseline risk of developing insomnia. And this would be related to genetic factors, biological factors, maybe traits that you have. Just whatever you're born with gives you some risk, maybe a low risk, maybe a higher risk. That's your baseline risk of insomnia, okay? And then for everybody at some point in life, something comes along that pushes you above that threshold. Something happens in life, a change, a stress, even something good. Maybe you start a new job or have a child. All these things can naturally disrupt sleep. That's just what happens in life. When we have changes and stressors, they'll affect our sleep often. So that's a precipitating factor, the thing that starts the sleep problem. And often what happens is there's an event, something changes, it affects sleep for an acute period or a short-term period, but then it gradually fades over time, and then that factor either goes away or you adapt to it, it's no longer affecting you as much, and then your sleep would go back to normal. So that's often what happens. But it's not always what happens. So sometimes even if that initial factor, that cause goes away, let's say you started a new job and it was initially really stressful and you were having trouble sleeping, but then over time you get used to it and you're not so stressed, your sleep would go back to normal. But it might not if you start to change some of the things you're doing and the way you think about sleep. So sometimes insomnia becomes its own thing and it will continue on. It becomes its sort of own beast that will outlive that initial stressor. So this would be changes in habits that people have. If you're trying to fix this insomnia problem, you'll start to change your habits, you'll start doing things differently, and sometimes that'll actually backfire and make it worse. It will end up keeping the problem going. So that's why we call this third factor in yellow, perpetuating factors. They're things that will keep the problem going. So it's changes in your habits, your behaviors, and it's also changes in the way that you're thinking about sleep. If you don't have a sleep problem, you don't think about sleep during the day, right? You just live your life. But if you have a chronic sleep problem, often people end up thinking about sleep a lot. They start thinking about it during the day. They're worried about it. They're frustrated about it. So their whole mindset about it starts to change. And the more you're thinking about it, the more you're worried and frustrated about it, that will end up keeping you up at night. So sometimes that's even the sole reason why someone still has insomnia. They might come in to see me, their insomnia started 10 years ago because of some specific event, and they're completely past that event. But now the insomnia itself has become this self-perpetuating problem. They are so frustrated by not being able to sleep. They're so anxious about whether they'll be able to sleep, and then that's keeping them up at night. So that's what we really need to work on, is that anxiety about sleep itself, the habits that have developed over time, okay? So when we're treating insomnia, the treatment that I'm doing is called CBTI, Cognitive Behavioral Therapy for Insomnia. And it's really about addressing those perpetuating factors when this has turned into a long-term problem. And applying this to all of you who have scleroderma, we can think of that maybe the onset of medical symptoms of an illness, that might be the green part, the precipitating factor. Maybe that initially caused the sleep disruption. But now, is it still that? Maybe that's still part of the picture, but other factors might have started to develop. So that's where we can work on those other things that you can control, okay? So as I said, CBTI is the name of the treatment that I do, and that's the gold standard treatment for insomnia. Because of what we know about how insomnia develops, this treatment is designed to address those factors that keep it going. So this is a behavioral treatment that I do with patients in the clinic, and I'm going to give you some of the strategies from that, just kind of a quick overview of some of those things that you could work on if you're having an insomnia issue. Before we talk about those specific strategies, I think it's important to understand what are those based on and why do they work? So it's based on what we know about how sleep actually happens. So I want you to think about sleep as something that's just a natural process, that sleep just happens on its own naturally as long as the conditions are right. It's not something we make happen. It just happens to us, right? It often happens when we're not trying to sleep. So the conditions for sleep to happen are that it's the right time of day, you're sleepy enough, and nothing is interfering with you being able to sleep. And we're going to talk about some of the implications of those things and how we can change our habits to address those. So the first two factors that are important are that sleep happens naturally when it's the right time of day and you're sleepy enough. Okay, so the first implication is that if possible, if you can sleep when your body naturally prefers to sleep, that's generally going to be more helpful. So this is your circadian rhythm. Are you an early bird? Are you a night owl? If you're someone who naturally wants to sleep from 9 to 5, that's just going to be when it's easiest for your body to sleep. Or are you a night owl and you don't get sleepy till 3 a.m.? Well, your body's going to naturally have the easiest time sleeping at 3 a.m. until 10 a.m. or 11 a.m. So that's your circadian rhythm. If you can go with that natural timing, that's helpful. Waking up every day at the same time, no matter how well you slept. This is a really, really important one. And I forgot to bold that, but if you take nothing else from this, if you're having an insomnia problem, this is probably the most important thing you can do is consistency. When people will let themselves sleep in too much, you'll get into this pattern of your sleep is just really up and down. You'll have a short night, then you'll catch up the next night, and then you'll have another short night, and then you'll catch up, and it keeps going in this cycle. So we want to get it as consistent as possible. So waking up at the same time is something that you have control over and makes a big difference. It's really helpful to aim for a consistent bedtime, but don't force it. So let's say you have a goal schedule of 10 p.m. to 6 a.m. So if 10 p.m. is when I'm aiming to go to bed, I'm aiming for that. But if I'm not sleepy, I'm not going to force it. I'm not going to go to bed and try to sleep if my body's not ready. So aim for a consistent bedtime, but don't go to bed if you're not sleepy. Don't try to make your sleep. It's not going to work. It's going to backfire. Prior to bed, make sure you're doing something that's calming, relaxing. This is different for everybody. Hopefully you have some kind of routine of things that for you help you to wind down. So this could be anything from reading your kids a bedtime story, watching some TV, talking to your spouse, something that's not work related, nothing where you're trying to be productive around the house. You're just being sedentary, calm, winding down. It's allowing your body to become ready for sleep. And one other note on that is just think about how much time do you need to wind down. Some people need a couple hours to really let themselves get ready for sleep. For you, it might be a half hour, an hour. So give yourself enough time. And then a final thing that's really important implication of these conditions is that you need to devote enough time to sleep, but not too much time. And if you give yourself too much time in bed, it actually will backfire. Your sleep will get worse. So let's talk about why that is. So for example, if you're someone who sleeps 7 hours a night, I would tell you should only spend 7.5 hours in bed, maybe 7.5 or 8 hours. You don't need more time than that. If you start spending more time in bed, say 10, 11 hours, what's going to happen is your sleep just starts to spread out and get more fragmented. You'll be awake more during the night. And what we want to do is try to keep your sleep more consolidated. That's going to feel a lot better and be less frustrating to you if you can just sleep, say, a solid 6 hours versus 6 hours that's spread out over 10 hours, right? That's what we're going for. So I want to diagram this for you of how this works. So what we're trying to do is maintain consolidated sleep. You can see in this example, the white means they're awake, the purple means they're asleep. So this person has really unconsolidated sleep. It's fragmented, it's broken up, but they're awake for a long time during these chunks during the night. So in the first line there, they're spending a total of 10 hours in bed and they're only sleeping 6 hours of that. In order to consolidate that, what we want to do is actually have their bedtime be closer to how much they're actually sleeping. So if we say you're only going to spend 7 hours in bed and we're going to delay the bedtime by 3 hours to get that, what happens is this. Okay, it gets consolidated. So it goes from this really fragmented pattern to being much more solid and consolidated. Same amount of total sleep, but that pattern is so much better, right? That is going to feel a lot better. It's going to feel more restful, even though it's the same amount of total sleep. Okay, our third condition for allowing sleep to happen is that nothing is interfering with you being able to sleep. And there are a lot of different things that can interfere with you being able to sleep. I'm sure you're well aware of some of those. So let's talk about a few broad categories. So one would be environmental factors. This is usually the easiest to address. This would be things like noise, light, the bed being comfortable enough, the temperature in the room being right. So you want to make sure that those are all addressed, that it's comfortable for you. If possible, we want to address medical factors. And of course, that's not always possible to eliminate those. You might be having pain, you might be having acid reflux, but to the extent that you can, managing those things, like some of the strategies that were talked about earlier for elevating the bed to try to reduce acid reflux, those sorts of things, to try to minimize the effect of medical factors as much as we can. And we also want to address psychological factors. The things that I hear most commonly from patients of what's keeping them up at night is they've just got racing thoughts. They're thinking about all sorts of things. They'll tell me I can't shut my brain off. They're thinking about things that happened the day before. They're thinking about what they have to do the next day. They're lying in bed, ruminating, worrying. Often they're worrying about not sleeping. So all of that is keeping them awake. For some people, there's underlying mental health issues of maybe depression, PTSD, OCD, all sorts of things that if that's something that you're dealing with, treatment for that is also going to help improve your sleep. So a big thing that interferes with sleep is trying to sleep. Whenever I ask people, what do you do if you can't sleep? The most common answer I get is, I lay in bed and I just try to sleep. I just close my eyes and I just try to sleep, which makes sense. If you want to sleep, you should stay in bed and try to sleep, but it just ends up backfiring, unfortunately. So don't fall into this trap. Don't just stay in bed. Don't try to sleep or try to force yourself to sleep. Putting effort into it actually makes it harder to sleep, because if you're putting effort into it, you're getting more alert, you're getting tense, you end up getting frustrated that you're not sleeping. It ends up getting harder and harder to sleep. So again, sleep is a natural process that just happens when the conditions are right. So trying to make it happen is actually going to interfere. I know that's a tricky one, but that's something that we work on is getting out of that trap of trying to sleep. For a lot of people, I think distraction strategies can really help with this. If you're lying in bed and you're not doing anything, it's really natural that you're just going to be thinking about things going on in life or thinking about sleep. So for some people, they can distract themselves by focusing on the sound of music or a meditation or the radio or an audiobook. That can get their mind off of those other thoughts, and then they'll naturally just become sleepy and able to fall asleep. Another really important strategy when we're addressing insomnia is that if you can't sleep, after a while, if you realize you're just not falling asleep, don't just lie there, get up and do something in another room. So we don't want these associations to develop. Over time, the bed will come to have these negative associations of frustration and being awake, and we don't want that to happen. So just get up and do something calming, go to another room, read a book, watch some TV, whatever you want to do that's just relaxing, not too stimulating. And then once you're starting to feel sleepy again, then come back to bed. Okay, so we're keeping the bed, we want the bed to just be associated with sleep and feeling calm. Not that the bed is a place where I'm frustrated and I toss and turn, and it can start to have these negative associations. So we want to prevent that from happening. Or if that has already happened, you're just retraining your brain to have different associations. So this is just a learning process that by getting out of bed when you get to that point you're not sleeping, you're retraining your brain to have more positive associations with the bed. Okay, and for this final section, I want to shift to talking about more of a mental health aspect and just some general strategies for how do you live a good life, even if you've got a chronic illness. So my background is in health psychology, and I don't think I've specifically worked with individuals with scleroderma, but I've worked with a lot of people with chronic pain, kidney disease, all sorts of chronic illness. So the strategies I'm going to present are things that I've used in treatment with different populations, things that can be helpful if you're living with a chronic illness. One strategy that I think can be really helpful is to take some time to think about what are your values and what's important to you. Sometimes your life can get really wrapped up in dealing with a medical illness. It can start to take over your life. You're spending a lot of time at doctor's appointments and trying to manage these symptoms, and your symptoms don't let you forget that they're there. But think about what's really important to you. What are your values? What do you want to drive your life? And then you can start to build a life around that and making goals. So values are the things that guide your life, that give your life direction, and then goals are specific things that you want to do. And I've listed just a handful of examples of values. There's dozens of these. So, and if you look online, just type in values inventory, you'll find lists of these or surveys that can help you to think about and identify what are the things that are really important to me. Is it family? Is it health? Is it relationships, financial security, whatever it is, whatever's important to you, identify that so that can start to guide your life. And once you've identified those values, then think about what are specific actions I want to take based on that. What are some specific, attainable, realistic goals? Goals that are realistic for how your life is now. And with a chronic illness, sometimes that's changed from what it was in the past. So that's important to think about. Maybe there's something you used to do that you've just stopped doing. But if it's something that's important to you and is related to a value you have, what's a way that you could still incorporate that in your life? Maybe it's a little different now than it was in the past, but how could you still do it? So for example, the one I put on the slide here is, let's say that you used to go to baseball games with your family, and that was really important to you. You really like that family time, but your fatigue and your pain just make it too hard to sit through a game, and you've just stopped doing that. Well, it doesn't have to be an all or nothing thing. Is there a way you could still incorporate that? Could you go for half of a game? Or could you invite people over to your house where it's more comfortable and watch the game there? Getting a little creative and thinking about, well, what's important to you? So how can I still incorporate those things into my life? With chronic illness, I think in general for anybody, actually, having daytime activities and some structure is really important. We know that if you're too busy, say you're over-structured, that can lead to stress and exhaustion and burnout. But on the other hand, if you have too much free time, like for example, let's say you're not working, you're retired, or you're disabled, if you've got too much free time and don't have things scheduled and planned, sometimes that can lead to depression and isolation, rumination, maybe being inactive and just not engaged enough in activities. So actually building in more routine, structure to your life can be really helpful. It helps you to feel better about the day, to accomplish more. And for you, you need to think about what's the balance that you want to have. How do you want to balance those things that are necessary, like chores or work, with things that are pleasurable and meaningful? How do you balance rest versus activity? How do you balance social time versus alone time? And what's the right balance for you of all of those things? If this is something that you wanted to think about more, a way you could work on this is to do something called the time audit, where you can track your time for a week, maybe by hour increments. Just write down what you were doing. At the end of the week, look at it, and it's taking stock of, well, how am I actually spending my time? And then does that match up with what's important to me and what I value? Maybe if I realize, I say I value family, but I'm only spending a couple hours a week on that, then it gives me some ideas for how do I need to work on changing that and shifting the balance a little bit of how I'm actually spending my time and getting that to reflect more of how I want to live my life. Social support is so important, and all of you here today, you're here because you're part of this group, you're here getting support. I think that's so important in dealing with a chronic illness, especially one that is pretty rare and maybe not a lot of people are dealing with. So social support comes in a lot of forms: your family, your friends, maybe your faith community, your colleagues. So think about, are you getting enough social support? And what are areas where you might be able to build this up some? And another helpful thing in thinking about relationships and your social life is the way you interact with other people and communicate with them. And sometimes you may need to be able to be a little bit more assertive or advocate for yourself. And this can take a lot of different forms. So maybe it means you're at the doctor's office and they're wanting to focus on something that's not your concern. So being assertive would be calmly and politely stepping in and saying, well, I really want to focus on this, making sure that your needs are getting met in that situation. Or maybe at work, you need to ask for some accommodations because of a physical issue that you're dealing with. That would be a way to be assertive, to stand up for yourself. It might mean disclosing information to a loved one so that they know more about what you're going through and can support you, and telling them, here's how you could help me, or here's what I need from you. That would be really advocating for yourself, getting what you need from those relationships. Does anyone ever listen to any of the guided meditations on Calm, Headspace, any of that? Yeah, there's a ton of these apps now, so I think they've become pretty popular and widespread. This is something I always talk about in sleep treatment, but I also use this in treatment for all sorts of other issues, including chronic pain and mental health. So I've included some pictures of a few apps that I recommend that are free, but there's a lot of other ones out there. So finding some guided relaxation, guided meditation, whatever type you like, it doesn't matter, but try these out. I would recommend you just try it if you never have. Listen to some, see what they're like. They can be really helpful in reducing tension, which can also help reduce pain. They also just give you a break from stress and pain during the day. For sleep, they can be useful as part of a wind down routine as you're getting ready for bed, help you let go of the stress of the day. You could listen to a guided meditation, or maybe you wake up during the night and you can't sleep. You could turn on that app and listen to it and fall asleep to it. So there's a ton of different options out there of different types of recordings. There's even things called sleep stories now that are designed to just be these kind of calming stories you can listen to. Whatever you like, these are really useful tools. So I would encourage you just to explore. I think it's a little hard to see that one app on the top left is called Insight Timer, and that one's free. So I often recommend that one just because there's a lot of options in it and it's completely free. And then these other apps are ones that were developed by the VA that also have some really nice recordings in them. One's called Mindfulness Coach. One is called CBTI Coach, which is designed to go along with the Insomnia Treatment, but it also has some meditations in it. And then Breathe to Relax is another VA app that teaches you how to do some deep breathing, which is a really helpful tool for decreasing stress and tension. General mental health treatment is also something to consider. If you're struggling with any of these issues on here, I just typed out some of the things that are really common reasons people would go seek treatment, either therapy or medication. Mental health treatment can be really helpful for specific mental health concerns, or even when it comes to dealing with just the mental aspects of living with a chronic illness. Like Dr. Brenner said today, they have psychologists in their GI clinic specifically to help people deal with those aspects of it and how it affects your life, your mood, and all of that. So that's something that can be really helpful for those kind of health-related issues or any other mental health issues. So if that's something you're interested in, both therapy and medications are really helpful for mental health concerns. If you're interested in medications, probably your primary care provider is a good place to start, or a psychiatrist. And if you're looking for therapy, there's several types of licensed professionals that can provide that. So there's psychologists, counselors, and social workers. Okay, so to wrap up, this is in your slides. I wanted to give you some resources if you're interested in looking into any of these things on your own and doing some more work. These are some resources for insomnia if you're having trouble falling asleep, staying asleep, and want to work on that on your own. There's some digital options, a few websites. The CBTI Coach app is more designed to be in conjunction with in-person therapy, but it has some background information in there that's helpful. The other websites offer basically a complete CBTI package where you could do that treatment on your own. And then there's some books that I think are really nice books on CBTI that you could use. And in terms of just general resources for information about sleep and mental health, here are some websites that are really reputable, have really good information on them. And a couple of book publishers, specifically for mental health related books, New Harbinger and Guilford, have really excellent workbooks and books on pain, anxiety, depression, all sorts of mental health related issues. So they've got some really great books for patients if you're looking for like a workbook to use on your own. Okay, so thank you so much, and if we have time, I can take a few questions.